Thank you, and good morning, everyone. So I am going to be the data geek in the group, and we're going to look at sort of the current state of the health workforce. So we're just trying to sort of get on the same page in terms of what the health workforce looks like. And so I am told, there we go. I always like to start with what you're going to get out of this presentation. So in case your phone rings, whatever, you get an email, what I want to talk to you about are some key points here. One is that new care delivery and payment models are really going to require that we broaden our definition of who's in the health workforce. The other trend that we see repeatedly is that healthcare services and the workforce are really shifting outpatient, and that training needs to follow suit. And that I would argue that efforts to reform health education training have traditionally focused on the pipeline, but we have 18 million workers who are already in the health system who will need to transform care, and we have to retool them as well. And because I'm a data geek, I couldn't leave the podium without telling you we need better data, and it's our job as workforce planners to give you that data, and so you need to push us, and those may be some of the issues that come up over the course of the next day and a half. So let's go. So basically, these are the professions, and I only select professions that you think of sort of in the traditional health workforce, right? Physicians, NPs, PAs. I sort of felt like we needed one of those Twitter things so that you can see that the number of NPs and PAs is increasing as we speak, one of the most rapid growth areas. But, you know, down to OTs and PTs, speech therapists, the sort of typical healthcare workforce, right? See some nodding heads. These are who we typically, not all inclusive, but mostly think of, who work with a lot of healthcare support occupations, particularly in long-term care. Look, about 1.5 million nursing assistants, a lot of medical assistants, another really growing health profession. These are incredibly important roles, and really Joanne Spetz will be talking a bit more about the fact that a lot of these groups are in long-term care, providing care to the aged. Now let's move to the fact that this, and if you're in social work or psychology, I haven't forgotten you. Increasingly, mental health workers and social service workers are at the forefront of where we think about the healthcare workforce. So we're sort of broadening our arms to include those social workers and others, marriage and family therapists, who quite honestly, as a healthcare workforce planner, I have not typically thought of. I mostly have done physicians, nurses, dentists, but this is a group, as we're looking sort of upstream, and I'm going to talk about that in a minute, we've really got to make sure that we're including in our healthcare workforce. Now, most of those health professionals that I just showed you are not employed in hospitals. In fact, most of them are employed in either ambulatory care, nursing and residential care facilities, or in social services, sort of in community-based. Where does our healthcare training mostly take place, right? So how well does that align? We're going to talk about that. So really only about 39% of the workforce is actually employed in a hospital setting. And this increased focus on upstream social determinants of health, knowing that really it's about what the factors in the patient's community that are really what generate health or not health. So what you see is actually, this is an analysis of jobs from 2007 to 2017. Where's the largest growth in jobs? Home health, other ambulatory settings. It wasn't in hospitals. And that shift is becoming more pronounced as payment models shift, start penalizing hospitals for readmissions. And so suddenly we're going to really have to look at sort of this shift as it relates to our healthcare education and training system. And many of the nursing reports that have come out recently, I've highlighted two of the ones that sort of jump out at me. The Macy report done by my personal hero, Tom Bodenheimer and Diana Mason, and then the American Academy of Ambulatory Care Nursing really looked at this, just I'm giving nursing as an example, recognizing that nurses traditionally have been educated in acute settings, but in fact are increasingly shifting to outpatient. And I really love this quote: despite the rapid evolution of ambulatory care, the current nursing system anchors its curriculum in acute care, and the unwritten supposition of nursing education that you have to start in inpatient to gain the skills, right? And so many people are questioning that, not just for nursing, but I hold nursing up as an example. Let's move to pharmacy as well. So the American Society of Health-System Pharmacists also did a report that actually foresaw a major shift in pharmacy from inpatient to outpatient. And 1/4 of the health systems that they surveyed expected to see a 10% shift of the pharmacy workforce from inpatient to outpatient. And almost half of them saw more pharmacists embedded on teams with physicians, nurse practitioners, OTs, others. And I loved this quote from a VP in a health system in Virginia. Pharmacy staff development programs should ensure there are adequate opportunities for education and training in the management of ambulatory care practice. So this is a recognition, just two examples from nursing and pharmacy, of where I think the education system and others have recognized the need to connect education and practice trends. And then the growth in ambulatory care has not stopped. Actually, in preparing for this presentation, this was an article that came out in Modern Healthcare, which was based on Bureau of Labor Statistics data, that showed since January of just this year, the ambulatory sector added 21,000 new jobs, which were more than 60% of all new healthcare hires, compared to 8,200 new hospital hires, right? And the greatest demand was for medical assistants, one of the most rapidly morphing roles in healthcare, and home health nurses. And when they looked at what was driving that shift, it was what payers, Medicare Advantage, Medicaid, and the Department of Veterans Affairs were actually paying for. And they're actually shifting their patients out of these expensive settings more towards upstream and home health. So payers are driving this shift in part. So I would argue that this shift really requires a much broader definition, right? So we've got to include in our umbrella of health workforce planning, and I mean me and Joanne and other health workforce people, more of the community-based workers. So in looking at the role of patient navigators, community health workers, home health workers, community paramedics, et cetera. And one of the roles that I'm equally, and I wish I had more time to talk about it because I'm passionate about it, is the evolving role of social workers. It is one of the most rapidly changing roles that we have out there, and we're monitoring it. This was just from one paper that we did, looking at the fact that social workers, and quite honestly, we didn't typically include them in our healthcare workforce projections, but now we are, and we're looking at their roles as behavioral health specialists, care managers, and those really incredible referral roles connecting patients to community resources. And don't forget the patient, and we haven't in this agenda, and we're going to talk about that, and I'm going to go really fast, but I'm very conscious that the patient is part of that healthcare team because we need to be promoting that shared decision-making, and we need to be focused on health literacy coaching and honoring and validating the work of caregivers, right? But also, had some great presentations and meetings lately where suddenly the healthcare workforce is including the clergy and medical legal people who are helping with debates over housing issues and getting your utilities shut off and whether you qualify for Medicaid. So medical lawyers are in our new definition of the healthcare workforce. So this is a great model, one of my favorite, and I wish I had more time to talk about it. Comes out of Johns Hopkins School of Nursing. Sounds a bit like a joke. An occupational therapist, a registered nurse, and a handyman go into a bar, but actually they go into a patient's home. And this is one of the most fabulous models that I know of that I like to say, so handymen are also in our definition of who's in the healthcare workforce, right? Because the OT is going in and sort of figuring out what kind of adjustments that need to be made to the home, and then the handyman is making the ramps and building the different accommodations that need to happen in the home. And the nurse is engaged with doing a lot of the care around sort of the activities of daily living and connecting the patient to the healthcare system. Fantastic model. I encourage you to look more at it. Those of you who know me, I'm passionate about this topic. This was a paper that we put out showing this chart just sort of shows the total healthcare workforce in the United States, the number of new entrants per year, and the percent that the new entrants comprise of the total healthcare workforce. What's the first thing that jumps out at you? It's a really small percent, right? So if you wait to transform the healthcare system by trying to just change the behaviors of students who are graduating, good luck. It's going to take forever. We really have got to work on retooling the existing workforce, and we're going to need, as Barbara's Center and others work on, these sort of collaborative practice environments that benefit not just the learners, but also patients and the healthcare system, because that's where real transformation is going to happen, and that's why this conference, this meeting, this workshop is so exciting. I want to end in the 47 seconds that I have showing you my great frustration. This is a graph by my great colleague, Peter Bearhouse, Doug Steger, and Dave Auerbach. Love their work, right? They've been trying to track hospital employment for nurses for a while. And what is this chart showing you? So the yellow line is hospitals. And you're seeing that their comment is full-time employment grew in the hospital sector, but was offset by a large decrease in non-hospital RN employment. You look at this and you think, Erin, this makes no sense. You just told us that non-hospital was growing. What's going on? I put this chart up as an example of how hard it is to actually count the number of people who are working outside of hospitals. Why? Because if I'm a nurse working in ambulatory practice that's owned by a hospital, am I employed by the hospital? How do I report that? So this is work that Joanne and I are trying to get at, because it's incredibly important. If we're going to provide you with the data that you need to do your jobs and understand what's happening in the healthcare workforce, we need to be able to track it better. And the other thing before I close that we're not capturing is those nurses and those pharmacists and those physicians and those social workers who are actually bridging between ambulatory and inpatient. And so this is my frustration as a data wonk, and I share it with you. So we're on it, and we'll keep working on it. Thanks very much.
We'll bring Joanne next. Thank you, Erin. Couple key thoughts as we transition. One, I'm surprised we didn't talk about maldistribution, but I know before this meeting is in, we will. The other thing that sort of comes to mind is that as we do this work to sort of innovate the workforce and think about health professions education, how critical it is to do that with humility and sort of with a much more broadened and inclusive spirit than we have in the past. So really fascinating. Thank you.